Good afternoon. Happy Monday to everyone. Thank you for being here this afternoon. Today, we are extending our executive orders to mitigate the damage of COVID-19. We are adding more counties to the list of those with enhanced measures, including requiring masks at public gatherings and at retail environments at 10 additional counties. We have to take COVID-19 seriously. This virus is not going away. There are lives on the line. We just got off a call with the White House Coronavirus Task Force, and I was unfortunately reported to the task force that on June the 27th, Mississippi had 490 confirmed COVID-19 cases in hospital beds across Mississippi. As of yesterday, that number had risen from 490 just 3 weeks ago to 909. I believe Dr. Dobbs will give you an updated number in a few minutes, and it has gone even higher. So over the last 3 weeks, we haven't quite doubled the number of individual Mississippians that are in hospital beds with COVID-19, but we have very, very, very close to having doubled over the last 3 weeks. That's in 20 short days. In essence, many of the measures that we were successful in implementing in March and April and May, and by we, I really do mean we, because while I can sit up here and talk, the only way we're going to see success in dealing with this virus is from you, the people of Mississippi, taking that additional step. This morning we reported 1,251 new cases, more than 900 hospitalizations. These numbers do not reflect the behavior that was occurring over the weekend. We all know that hospitalizations and ultimately deaths, unfortunately, are a lagging indicator. So what we're seeing today is based upon the actions that were being done 2 and 3 and some even 4 weeks ago. In some instances, even 6 weeks ago, as the younger people got the virus in late May, early to mid-June, and it takes a couple of iterations before it ultimately gets to those who end up requiring hospitalization. I know that from what I have heard anecdotally, there was much better compliance over the last 7 days than there was in the month of June. In fact, from what I can tell, we are having many, many more Mississippians that are participating in wearing masks in public, not only in those counties where it is mandated, but also in all 82 counties across our state. I believe that that is extremely important. Now, some of you may have seen it on social media, but I want to take the opportunity here to remind you that the 10 counties that we added, we extended this order for the 13 counties that we added 10 days or so ago. But we also added 10 counties, so we now have 23 of our 82 counties with a mandatory mask requirement. The counties that we added were Bolivar, Covington, Forest, Humphreys, Panola, Sharkey, Simpson, Tallahatchie, Tate, and Walthall counties. As a reminder, they joined Claiborne, DeSoto, Grenada, Harrison, Hines, Jackson, Jefferson, Madison, Quitman, Rankin, Sunflower, Washington, and Wayne County. The extension will run for 2 weeks from today. It began this morning at 8 a.m. It will go 2 weeks from today. We will continue to assess in real time, and should we need to add additional counties over the next several weeks, we will make the hard decision to do so. Now, I want everyone to understand, we did not just pick these counties out of the blue. We didn't just say, well, let's get a random sample and see what happens. These are based upon an objective criteria. If your county has more than 200 cases in the last 14 days, or if your county has more than 500 cases per 100,000 residents over the last 14 days, then your county was added. We're not just making this up as we go along. We're letting the data drive the decision making, and we're following that data every step of the way. These 23 counties have met a criteria that we believe is worthy of additional measures. But if you are not in those 23 counties, it does not mean that the virus is not in your community. Quite the contrary, the virus is in every community. And so we're asking every Mississippian to wear a mask. We want to slow the spread now so that our hospital system, which is already stressed, doesn't get more so. We're also working on additional measures to ensure that our hospitals surge capacity when they need to. Right now, we're not getting 100% cooperation, but we're working to do better. We're working to communicate with those in the healthcare industry and ensure that they put public health first. That's where we find ourselves today. All of us as Mississippians must lean in. Those of us that get up and go to work every day and providing food for their families, we need you to do just a little bit more by wearing a mask in public. Those of us that work in our healthcare space, we ask all of us to just lean in even more. And understand, I realize this is basically month 6 or month 7 for many of us dealing with the coronavirus. A lot of us are tired of it, but it's still here. And quite frankly, the number of cases on a daily basis, the number of hospitalizations, the number of patients in ICU beds, and ultimately the number of patients on ventilators are worse today than they've been at any time since March the 11th when we received our first case. Because of that, we've got to redouble our efforts. We've got to come together as one and make a difference. With that, I'm going to turn it over to Dr. Dobbs to give us an update on numbers.
Thank you, Governor. Today, as you mentioned, we're reporting 1,251 new cases and 3 additional deaths. As you've noticed, we've had quite a run of days over 1,000, and we see no likely let-up in that for the near future. Any interventions that take place now are going to take weeks before any benefit is noted. If we look at the situation with hospitals, it's something that gives us great concern. Just as a snapshot update, one of my staff just sent me that we have now 943 confirmed coronavirus cases that are hospitalized and 293 coronavirus patients in intensive care. That puts us looking at about 40% of all of our ICU cases have coronavirus. That's a phenomenal number, and it continues to grow. Just Friday, it was only 31%. So that we're growing so quickly really tells us that we're, at the verge of really pushing our system over its capacity. In large measure, we're already there. If we look at the number of hospitals that have 0 ICU beds, currently that stands at 9. But if we look at the number of ICU beds available for the 4 largest medical centers in the Jackson metro area, there is 1 ICU bed currently available. So again, very, very tight. We have 16 hospitals that have less than 10% of ICU capacity. Again, that's really kind of a pain point for us as far as ICU capacity is concerned. If we look at reporting, one of the things I do want to just mention to our healthcare colleagues out there, if y'all aren't hearing it from other mechanisms, we are not getting all of the cases reported to us from rapid tests. As a matter of fact, I have verified that a large, popular, independent urgent care chain in the Jackson area and other parts of Mississippi is not reporting all of the antigen tests. So even though we're seeing this huge number of cases, it's not representing all the positives out there. So all medical clinics, please know it is mandated by law that you report coronavirus cases to the Department of Health so that we can investigate them. One other just quick update. I know that there's interest in the outbreak at the Capitol. Information that I got a quick update this morning is we have 45 verified cases and 31 verified among legislators. We can keep you updated that as we go forth, and as you're aware, some of those individuals are quite ill, unfortunately. This also speaks to how the virus works. Most of the people in this outbreak caught the disease around the first week in the first part of July and are just now manifesting disease severe enough to require hospitalization or intensive care unit stay, and that's why there's such a lag. The cases that we start seeing today may not be in the intensive care unit for another 3 weeks. So again, getting what the governor said, what we're seeing now reflects what we did 2 and 3 weeks ago. So we've got a long way to go based on the case burden that we are seeing right now as far as the stress on the hospital system. And then one myth buster for the day. I've been getting these questions about people are filling out COVID on every death certificate, or if someone dies in a car wreck, they're putting COVID just to boost the death numbers. That is not happening. Whenever we get a COVID report from a death certificate, we go back and validate that they have a positive test. Positive testing is the foundation of our reporting. And in rare circumstances, there is not that information, but if it's validated in their medical records, then a very small number would be considered. But if there are some that we kick out from death certificate reports because they don't seem to meet proper criteria. So there is no goosing of the numbers with deaths. The people who are dying with coronavirus are dying with coronavirus. That's all I have, Governor. Thank you.
I just want to reiterate something that Dr. Dobbs said with respect to reporting. It is critically important that every institution, every physician's office, etc., report to the Department of Health. I also want to just reiterate, it is critically important. I know there's been a lot of conversation over the last 72 hours in America regarding the reporting move from CDC to HHS. Secretary Azar was on our call a little while ago. He made it very clear that reporting through HHS is incredibly important, because when the federal government is making resource allocation decisions, and while I know a lot of us wish that they weren't making resource allocation decisions, but that's where we find ourselves, they can only make those decisions if they have good, strong, accurate data. It is incredibly important that we report to HHS and that we report accurate data. If we are underreporting our cases, if we are underreporting those going into ICU beds, if we're underreporting those who are going into and onto the ventilator, that is not good for us when we're trying to get more remdesivir, for instance, transferred to our state. We're working very hard to get more of the rapid testing, particularly in our nursing homes. We are fighting with every other state to get those. There is a limited supply, but we believe that we're in a good position, but we have to report accurately to the federal government. And so to all of our friends in the healthcare space, again, I reiterate, we do have executive orders in place, and we have in the CARES Act and federal law mandatory reporting, and if you're not doing it, then you are in violation of our laws. With that, I'm going to turn it over to our Director Michelle, our emergency management team leader.
Thank you, Governor. Just really two things today to give you an update on. Just the first one is really a reminder about the COVID-19 emergency relief program. There are two tracks on that for counties and municipalities to get reimbursed for expenditures. One of those is the public assistance track. That is open now, and we have been taking applications on that since the beginning of this. A little over 300 counties and municipalities have already made application to FEMA. You can go to grantee.fema.gov and apply directly for that. So that process is open now. For the CARES Act funding and reimbursements, as I mentioned before, we're still working that new process for the 100% reimbursement for those expenses not covered under public assistance, but that are covered under the language in the CARES Act bill. That will be available information by July the 31st, and then the application periods will open on August the 3rd and remain open until August the 15th. So just a reminder there. Quick tropic update. If you've been watching the weather, you will know that there are about 3 systems that we're watching out there now. The closest one is just off the coast of Texas and the Gulf Coast. The other 2, one is way out in the Caribbean, tracking northwestward towards the Gulf of Mexico, and then the final system is basically still a tropical wave out in the Atlantic. The one off the coast, Texas coast, is about a 10% chance of development over the next 5 days. And then the other two systems are still a little bit too far off to tell, but are predicted about 20% chance of development over the course of the next 5 days. With these three systems out there, just indicative that the later we go into hurricane season, the more active we can anticipate that. So we'll keep an eye on that. And this is a final note of interest. We did have a 2.3 Richter scale earthquake early this morning, about 6:45. It was in the vicinity of Clarksdale, about 30 miles north. So just indicative that we're having to keep our eyes on a lot of potential disasters this day and age. So we'll continue to watch and monitor those things. Governor, that's all I have today, sir.
Thank you. We will now open the floor to questions. Cordian?
Governor, both for you and Dr. Dobbs, just want to get into the orders just a little bit more. Governor, for you, that amendment to the safe return order about the 10% capacity, I want to make sure I understand that correctly. It was originally 25% and now it's 10. Can you speak to that? And then Dr. Dobbs, for your order that you put out to the hospitals over the weekend, can you just kind of break that down?
What I'll do is I'll let Dr. Dobbs talk to both of them because they're basically they're the same order. His was a public health order and ours was actually in the executive order from the governor. So let him speak to that.
No, thanks, Governor. The point of this is that hospitals need to activate their surge plans, and part of that is making sure at any moment they have 10% of capacity available that they can accept coronavirus patients who are in urgent need of care. And if they're unable to meet that measure, then that's indication that they're not resourced enough to serve all functions, and they need to delay elective surgeries that require hospitalization. Now, I will say that our preliminary evaluation of the elective surgery restrictions from last week netted us, well over 100 beds across the state. So, I mean, it does work as far as freeing up hospital floor bed space, less or so ICU bed space, but it does decompress the system and off-burden some of the staff. So we know it's an important function of our hospitals, but the main point is to make sure that we prioritize access to care for critically ill folks. That's got to be our priority, and hospitals are surging up their capacity to meet the need, but we foresee that even the surge capacity may well be insufficient for the need.
I'll just follow up with that and simply say that as we worked over the last several months, one of the things I think we have jointly determined in working with those in the healthcare space and our hospitals is the 25% number is probably unrealistic, and so I don't want to leave the impression that we've gone from 25 to 10, which is lessening. In essence, what we've done is we've agreed to work with our hospitals and reduce it from 25 to 10, which is a more realistic number. And oh, by the way, the 10% is going to be enforced. We are going to cut off elective surgeries for those hospitals that choose not to comply. Now, as Dr. Dobbs has said, the last week things have improved significantly, more compliance, and we're pleased with that. But we are going to ensure that this 10% number is enforced in such a way that elective surgeries, which we want hospitals to be able to continue to perform elective surgeries. We just want to recognize that when we get into a situation in which capacity is an issue, we don't want hospitals being forced or choosing, or however you want to word it, to not be able to take patients because they don't have the capacity to take them if there's a critical need.
Scott. Governor, you've added 10 more counties now. You said that you don't believe in a statewide mask mandate. You've also talked about bar restrictions. Is that where the next level is coming if you don't see a reduction in numbers coming, that type of reduction, as opposed to the statewide mask mandate?
I think that there is no doubt that we're having much dialogue about restaurant capacity. We're having dialogue about bars and particularly compliance with bars. I had very good conversations late last week with a group of mayors on the Mississippi Gulf Coast. I had calls early last week with the mayors and the supervisors and many county-wide elected officials. Again, as I've said before and I said over the weekend, I can write all the words on whatever page you want to choose from, and it doesn't do any good unless we have participation by our fellow Mississippians. So in other words, if we put a mandate, for instance, on a particular type of restaurant or a particular type of bar, and we don't have enforcement, then it doesn't do any good. And so what we want to do is we want to put words on the page. We want to have executive orders that we can have buy-in by everyone that they participate in it. And so when you look at the 10 counties that we added, they met the objective criteria that we have put in place. And I think what I have seen just anecdotally over the last week, we are getting more and more compliance of wearing masks in public. Now, again, I'm not sure that everyone is an expert in how you're supposed to wear a mask. If the mask is not over your nose and under your chin, it's not necessarily doing you any good if you're covering up your ear or just covering up your chin. Now, I sort of make light of that, but most of us are not used to wearing masks. Most of us do not want to wear a mask, do not like to wear a mask. I kid with the docs all the time. The mask just look more natural on them for some reason, but it's important. It's critically important to slow the spread. In talking to Dr. Fauci and Dr. Birx on the call earlier, they were both adamant that they believe that if we can maintain social distancing, that if we will wear masks in public, that if we will do the little things, we think ensuring capacity in restaurants, stay at that half a capacity, that we have no more than a group of 8 or 10 at a table, that we have those tables that are spread out, that we can significantly reduce the spread, because where you really get into trouble is when you have one person who has the virus goes into a large group, and that one person then spreads it to 25 or 30, who then go spread it to 25 or 30, and then you go from 1 to 50, just like that. That's what we've got to avoid. And what we want to do, we want to make these decisions to do these little things now so that we don't have to get back to the point where we're shutting down private businesses, which is something that I am adamantly opposed to. But we've got to keep public health at the forefront. Yes, please.
Dr. Doc, some people have been saying that they've been waiting at least 8 days to get their results back from the coronavirus test. Is that normal, and what may be to blame for that?
Well, there are several things to blame for that, but primarily the private labs have been overwhelmed. That's been something that's been a specific issue with the private reference labs. So there's different ways to get a test, right? So you can do a rapid test, and then those are same-day results. But typically, most of them go to reference labs like at LabCorp, Quest, or Mayo, AEL, just to mention a few, and they've been backlogged severely, in large measure because of all the number of cases in Florida, Texas. These labs service multiple states, and so basically it's a capacity issue with the private labs, and it could continue to be a problem. Every resource is exhaustible, and if we overload the system with sick folks, these sorts of things unfortunately going to be happening. We're trying to surge up our capacity at the public health lab. We've been able to maintain pretty good turnaround, but we have a different mission than just a clinical support. But that's a real challenge, and hopefully that's going to work its way out with private systems soon.
Just because we've always tried to be very transparent with the people of Mississippi, it's easy to sit here and be critical of the private labs, and because 7 or 8 days is not an acceptable number. But let's think about what has happened over the last 8 weeks. We went through a period of time where testing demand was very high going into mid to late May, and then it's almost as if the country completely forgot that coronavirus existed. And if you look at demand for tests in early to mid-June, all the way into late June, it declined significantly in our state, and I think it did in every other state around us. And so as the demand for testing was coming down, then they were very easily meeting the turnaround time being very, very quickly. And then all of a sudden, boom, in early July, the demand for tests goes up significantly, and we get further and further behind. And it's complicated, and it certainly complicates decision-making by those of us who have to make decisions, because we are driven by data, and the sooner we can get data back, the better off we are. Yes, ma'am.
This question is about contact tracing. Dr. Dobbs, I remember earlier on you would talk about that being part of the strategy to slow the spread. But where are we now? Where is contact tracing now? What's the status of that, especially amid so many outbreaks statewide?
Yeah, so of course we're still doing it, but we're significantly behind for a host of reasons. Massive increase in cases has been more than we had staff for, and we're continually adding staff And we'll be putting out a request for contracts this week to add another 100 contact tracers. But the other problem is, and this is something that's really important, is if it takes 7 to 8 days to get the lab back, by the time the Department of Health is aware of it, the patient's no longer contagious. And so we miss the opportunity if we don't get that result back immediately. So there's a lot of stuff baked into that. One of the things that's really important is for people who think you have coronavirus, go ahead and isolate yourself. We've talked with the state's physicians to make sure that they put their patients on isolation immediately when they suspect coronavirus, because time is of the essence. We have to do it immediately. The thing that's so important with us for case investigation now is even when we're behind, for whatever reason, is we get that information so we can understand the outbreak. All that information we put on our website that we share comes from case investigation. So it's a very important component of doing that. And the other issue is we still get a lot of faxes, for reports. And you can imagine going through 1,200, 1,300 faxes, how cumbersome that is. And it's very inefficient. So we're trying to move the docs and the labs to electronic format so that we can process it more efficiently.
One of the things that we've said for months now is if you think you've been exposed, or if you think that you have some symptoms, if you're in doubt, get a test. I think we're at a phase now in which every Mississippian should assume that everyone they can look in a room and see, just assume that they have the virus and stay socially distanced, wear a mask, don't get within 6 feet of them, and don't get in large groups. Just assume that everyone has it. And if every Mississippian would take that approach, it would go a long way towards helping us slow the spread of this virus. Because the reality is that we do have significant transmission in the community, and we've got to get control of it. Renee?
Dave Elliott with WOX has a question.
Thank you so much, Renee. Governor, you extend your orders to August 3rd. School starts August 5th, 6th. That's a pretty narrow window. Considering the alarming numbers, I'm going to ask you this one more time. The possibility of maybe delaying the start of school into September. You talked about education rules with compulsory days and testing. Do you or the State Department of Health have the authority to supersede those directives, the state and federal standards on days and testing?
Yes, we can work with the State Department of Education to reduce the number of days that have to occur, the 180-day rule, as it is known by. But I had a great long conversation with our head of the State Department of Education, both the board and Dr. Wright, and at this point there is no intention of reducing the 180 days for the current school year.
Nick Drew with Jackson Free Press has a question.
Yes, Dr. Dobbs, you estimate 170 hospitalizations for every 1,000 positive tests. MSPH has given us really excellent data on hospital usage, so we have an idea of the remaining capacity. At this trajectory, though, what's our runway? What date do we truly hit max capacity, and what date do we need to crush the spike to prevent that?
Oh boy, that's such a good question. And certainly within a week or so, we would anticipate, or maybe 2 weeks or so, that we would exhaust our surge capacity within our healthcare system. And so we're looking at other options beyond that. But we may be at crisis standards of care within the next several weeks if we're not careful. And what does that mean? It means it's a little bit different healthcare system. It's putting people in open wards. It's doubling up rooms. It's housing people in places that they don't normally stay for medical care. We're looking at all contingencies right now as far as like what do we do when we get to that time point. But if we don't see a decrease in transmission immediately, then it's pretty likely that the healthcare system is going to be thoroughly overwhelmed. And I know sometimes it seems like I'm doomsday, but how many weeks ago did we say that we're going to have a bunch of hospitalizations? And how many weeks ago did we say we're going to have more deaths? And how many weeks ago did we say we're going to run out of ICU rooms? I mean, it's happening. We're taking care of ICU patients in ERs every day. We've converted our ERs into makeshift intensive care units until we can find a place to put them. I got a call about sending a patient to Missouri yesterday because we couldn't find a hospital bed for a certain person in the surrounding states. I mean, this is a real situation that's affecting average, everyday Mississippians, whether you have coronavirus or not. So the main thing to do is we have to be careful. And I can't tell you how disheartening it is to get pictures and notifications from restaurants where people aren't socially distancing or they're having huge parties and young people are just having fun with no masks like there's no tomorrow. Social gatherings on, block parties, folks doing athletic events in large groups. I mean, we're going. There's a price for everything. There's no free lunch, and we're paying the price for what happened 4th of July right now, and we're going to pay the price for what's happening right now in 3 or 4 weeks from now.
And I just, want to again mention something because we talked about it a lot in March and April, and a lot of you asked me, what is the difference between where we find ourselves today with COVID and say the immediate aftermath of Hurricane Katrina? And I think given what's happening in the South and the Southwest right now, it's very important to point out that in Hurricane Katrina, basically Louisiana and Mississippi were hit, and the other 48 states rallied to help us. And they came from all over. They literally came from everywhere to help us immediately after Hurricane Katrina. Well, because of what's happening in Alabama and because of what's happening in Louisiana right now, I mean, we're not in this alone. It's not as if we're having these conversations and Mississippi is the only one affected. It's not as if you're hurt or you need an ICU bed on the Mississippi Gulf Coast that you can just shift them to Mobile or shift them to New Orleans and all is good. There's not a lot of room in the inn in Mobile, and there's not a lot of room in the inn in New Orleans either. And that's what's compounded the problem with respect to hospital capacity, is where we would normally, if we found ourselves in a situation like this, be able to utilize Birmingham or Memphis or maybe even Little Rock or New Orleans or Mobile. They're all experiencing a significant uptick in cases right now as well. It's not unique to us, and so it's not a reason to celebrate, by the way. They've got it bad too, but we've all got to be willing to take care of ourselves, and we've got to be willing to step up and do the little things that can make a big difference.
Will Strickland with DeSoto Times Tribune has a question.
Hi, question for Governor Reeves. This morning I went to a DeSoto County School Board meeting. No board members were wearing masks. And at the beginning of the meeting, they had an award ceremony to recognize their nutritional workers, the lunch ladies. Over 50 of them were in that room, and almost none of them were wearing masks. So how can parents trust that their school district has their children's best interests at heart if school staff and district leaders are not following your executive order and taking adequate social distancing precautions even now?
Yeah, obviously I didn't know anything about that particular meeting, but I do believe we can go back to school. I believe that we can do it in a safe, responsible way, but it is going to include doing little things like staying spaced out by wearing masks, and I will tell you that is particularly true in those 23 counties that I have named, and DeSoto is one of those. DeSoto is not on the list just because I picked it out of the sky. DeSoto County, I'll give you these numbers. In the last 14 days, DeSoto County has had 587 cases. 587. We are going to have to recognize that none of us are invincible. Scott.
If I could change gears on a subject to ask about the flag commission selections. The deadline is passed. I haven't heard if you've named your appointments. Are you going to? Could that impact the legality of the law because you missed that deadline?
I do intend to appoint 3 members. The latest I've received from my team, we've selected 2 of the 3, and we'll get the 3rd one relatively soon. Just to be perfectly honest with you, COVID-19 is real. We're working on hospital capacity. We will get to that as soon as we possibly can.
Do you think it could impact the fact that the law had a deadline in it that wasn't met? Could that be legally effective?
No. Yes, sir.
This is for Director Michelle. With severe weather, we're in the beginning of the severe weather season down on the Gulf Coast. Are the shelters prepared for COVID-19 potential? People coming in that may or may not be tested, may or may not have, safety gear, precautions. Are the shelters ready to handle that, and what have you in place?
Yep, good question. We actually had meetings with famed Administrator Pete Gaynor this last week, came and visited us along with Louisiana, left us and went to Alabama. We talked about shelters. When you ask about are they prepared, they are prepared from the standpoint of they have the appropriate PPE set aside, they have their protocol put into place. But as I have said a number of times here, we are advocating and will continue to message as we get closer and closer to what we think is going to be a violent season, that people evacuate and avoid using a shelter if they can, and there are ways that they can do that. And then we've got operations in place and plans in place for non-congregate shelters where we don't have to put everyone in a cohabitated position. Shelters are going to have to be used. We know that congregate shelters will be utilized. They will be open. And at the end of the day, it really goes back to people being responsible, wearing masks, social distancing. And together, yes, we can provide safe shelters for people during hurricane season.
Cordia.
Dr. Dobbs, we're having more and more folks reaching out asking what the latest research is showing as it relates to antibodies. I know early on we talked about it, but people, now that more folks have had it, are saying, wait, do we think we can get it again? What is the latest research showing, or it has much changed?
It continues to evolve. We still don't know everything about it, obviously. As far as just how many people have, so antibodies basically mean that you've had it at some point in the past, but probably not acutely, depending on the type of test you get. And it probably indicates some degree of immunity. Multiple lines of evidence suggest that probably people are immune once you've had it. We don't know for certain. There are some reports of reinfection that we haven't been able to validate. We've had a couple in Mississippi that we've sent to CDC and still haven't heard anything back on. Looking at everything, my personal view is that probably most people have a robust immune response afterwards, that they're immune. The duration of that immunity is unclear. If we look at SARS from the previous iteration, that people did maintain pretty strong immune responses for 2 or 3 years, but then had some residual for up to 17 years. So probably going to be a worthwhile immunity from that, and speaks well to maybe the effectiveness of the vaccine. But the other piece about that is still most people in Mississippi haven't gotten it. I mean, it's going to be less than 10% of people in Mississippi have had it so far. Again, this herd immunity concept doesn't really come into play at anywhere until you get close to 70, 80%. And then I got a report from the Red Cross today of all the people they've checked at the blood banks, only 1.5% of Mississippians have had antibodies. So now that's not a random sample, but still it just says it's just, not that many people in Mississippi have had it yet. And this is the kind of turmoil we're living through, even with that small number.
Yes, ma'am.
Speaking of DeSoto County, DeSoto is one district not requiring students to wear masks when they return to schools. So my question is, what are your thoughts about districts not requiring students to wear a mask, especially high school students, which we've heard Dr. Dobbs say are transmitters of the virus?
Yeah, it is my intention to receive all of the back-to-school plans by July 31, which is when they are due to the State Department of Education. There's obviously going to be 138 or 37 total plans. They're going to differ. We take great pride in Mississippi in allowing our local districts to make decisions, but I'm going to review those once we get them, and I'll decide at that point if the necessary precautions are being taken to safely return our kids back to school. There is no question, if you listen to the American Academy of Pediatricians, that there are significant risk with going back to school, but there are even more risks to kids by not going back to school. But we've got to make sure that everyone does it in a safe, responsible way.
Bobby Harrison from Mississippi Today has a question.
Dr. Dobbs, I'm sorry, on my Zoom, sometimes you break up. Could you go back and repeat the numbers on?
The numbers on hospitalizations or?
hospital, about the special session and closer to.
I think he said
Yes.
the numbers of the special session.
Oh, of the
legislature.
capital.
Legislature.
The hospitalization numbers you gave at the beginning of your statement.
No.
Okay, great. Yeah, so, yeah, right, so right now, we have a snapshot of, we just took a minute ago, 943 people hospitalized with confirmed coronavirus and 293 with confirmed coronavirus in intensive care, and that accounts for about 40% of all intensive care bed use in the whole state. And then I said that there were 9 hospitals throughout the state of Mississippi, mostly big hospitals that have 0 ICU beds, and of the big 4 hospitals in the Jackson metro area, there is 1 ICU bed currently available.
Cordia?
I'm just thinking through that. Does that mean that there are some hospitals that currently are in violation of the order with the 10% capacity?
Well, if they don't surge, they need to surge if they want to keep doing electives. So now's the time for them to step up and take care of the folks who need the help, so that we can take care of not only the COVID patients but other people who need surgical procedures that will improve their health and well-being. Yep. Thanks.
There are 2 options. There's the option of surging capacity, which certainly every level 1 and level 2 and many other hospitals have plans in place where they can surge capacity. So one option is that you surge capacity, which, by the way, I'm not suggesting is cheap or easy or anything, but that is one option. The other option is that you free up beds by reducing the number of elective surgeries. You can do that by choice at the administrator level, or we'll come in and do it if we have to. But we hope it doesn't get to that, and we don't think that it will. We think that our administrators will step up and free up that capacity. Yes.
And Dr. Dobbs, at any time would National Guard facilities be used to house additional? I mean, they have plenty of space. They could be controlled. They could be easily cleaned because they're bare bones and set up. Would there ever be an opportunity or reason to do that?
Yeah, there might be. Certainly, we've discussed that as an option. I mean, one of the things that's really important right now is our critical weakness is an intensive care unit, and so that's a different resource. I mean, someone who's recuperating or kind of sick but getting better, that doesn't need intensive. To get intensive care, you need to be an intensive care unit, and it's not really plausible to really convert those. There's other that could work for that. But as far as like the whole stream from intensive care to hospital beds to convalescing hospitals that we're using also in the Guard sort of areas, they're all on the table, and it's a good backup that we may have to tap into before long.
Bobby with Mississippi Today has another question.
Governor, are you any closer to knowing when you would call a special session, or is it still too early to say?
Thanks for the question, Bobby. It's too early to say. I know that there are multiple legislators who are still in the hospital. There are some even in really bad shape, and so we're going to make sure that we get to a point where we, if and when we bring them back, we're going to do it at a time when it is safe to do so. And we're just not there yet. Seeing no further questions at this time, I want to thank all of you for being here. We'll be back soon. Everyone, to my fellow Mississippians, please stay safe. Thank you all, and God bless.